All right. Thank you so much for joining us this morning as we are endeavoring to provide updates on the devastating cuts to healthcare and food assistance that we are now facing in the Commonwealth of Virginia as a result of the so-called One Big Beautiful Bill. We're also going to talk about how Virginia is working to contend with and mitigate some of the worst of the harms caused by this bad policy. Certainly at a time when families are already struggling to afford healthcare and groceries and gas, the president and his allies in Congress have made the deepest cuts to Medicaid and SNAP in history. The impacts on Virginia families are and will be significant. Because of these federal cuts, Virginians are at risk of losing their healthcare coverage, their ability to find care where they live, their access to food assistance that they may need to feed their families. More than 300,000 Virginians on Medicaid risk losing their coverage. And additionally, this legislation weakens Medicare's authority to negotiate prescription drug prices. That is an authority that I was proud to vote to establish while serving in Congress. According to a recent report from the Joint Commission on Health Care, 13 Virginia hospitals are at serious risk of closure. Nearly 7,000 Virginians who rely on SNAP are at risk of losing their food assistance. Billions of dollars are being pulled out of our healthcare system here in the Commonwealth, and we are being required to spend millions upon millions to implement these new federal requirements and administrative processes. These cuts will not only threaten certain communities and certain families, the overall loss of coverage will make healthcare more expensive and less accessible to all Virginians, not just those on Medicaid, not just those who live in rural communities, not just those who use SNAP to help put food on the table. When Virginians lose their health coverage, premiums will go up for everyone else. The impact will be felt across Virginia. When I took office in January, there had been no infrastructure put in place to contend with the impending impacts of this bill. But since the start of the year, we have gotten to work. The budget I signed into law earlier this year set aside more than $500 million to contend with the worst of the One Big Beautiful Bill. We reserved $350 million as a cushion for higher than expected state medical costs and to help stabilize our healthcare system overall amid the loss of federal subsidies. Our budget includes $150 million towards ACA premium assistance for Virginians. Virginians who are losing access to affordable health care coverage. And we are working to cut monthly premiums for eligible Virginians by about 70% starting next year by utilizing those stabilization funds. But the reality is that Virginia will not be able to make up the difference in a loss of federal funds. We will not be able to close the entirety of the gap caused by this catastrophic legislation. We are working to mitigate every possible harm that we can as an administration. But to be clear, H.R. 1, the so-called One Big Beautiful Bill, was put in place as a cost-cutting mechanism at the federal level. That's a cost-cutting mechanism meant to allow for the reconciliation bill to move forward, and those cost cuts are going to be borne by Virginians and our healthcare system overall. And with that, I am turning it over to the Secretary of Health and Human Resources, Marvin Figuero.
Thank you, Governor, and good morning, everyone. For nearly 2 million Virginians, Medicaid is not just a government program. It is a doctor who manages a child's asthma. It is medicine that keeps a parent healthy enough to work. And for more than 7,500 Virginians, SNAP means food on the table. It means a parent does not have to choose between groceries, rent, and prescription drugs. The federal law known as H.R. 1 changed the rules for all of them. It makes sweeping changes to Medicaid and to SNAP. It creates new paperwork, new deadlines, new costs for Virginia, and new risks for families, providers, and communities. What I will do today is go through a short presentation giving you overviews of how the law will function, timelines for implementation, but more importantly, how Virginia will react. Here in Virginia, we believe that we will use every lawful tool available to keep eligible Virginians covered, help families navigate the new rules, and fight unnecessary harm. So we'll start the presentation with that. So let's begin with the bottom line. The federal law changes who is eligible for Medicaid and SNAP. It changes what people must do to remain eligible. It changes how doctors and hospitals are paid, and it shifts substantial new costs and responsibilities to the Commonwealth. If we go back to July 25th, 2025, you remember that the reconciliation process and conversation was all about this. Congress was mandated to find $1 trillion worth of savings over a 10-year period. What savings means in this situation is cuts, and cuts to Medicaid primarily. And so when we look at the numbers and we think about what it looks like for Virginians to lose coverage, this is by design. It was baked into how you achieve and unlock the tax cuts to have these losses happen through the Medicaid program. And so a way to baseline is that we are trying to reduce harm, but because the intended goal was to have people lose coverage, we won't be able to prevent these harms 100%. I'll keep you on this slide and say that the scale of this challenge is significant. Nearly 2 million Virginians are enrolled in Medicaid. More than 500,000 Medicaid members are expected to be subject to the new work requirements. Of that, our current estimate is that nearly 300,000 Virginians are at risk of losing Medicaid coverage. Some will lose coverage because federal law changes who qualifies. Others may still be eligible but lose coverage because a form was missed, a notice was misunderstood, or the process became too difficult to navigate. That distinction matters. A paperwork failure should not become a healthcare crisis. These changes also carry significant financial consequences for Virginia that I will go through it in more detail.
And by our estimates, approximately 300,000 Virginians who are eligible for care will need to take an action. Otherwise, they will lose that coverage.
That's exactly right, Governor. Here is the Medicaid provision. So when we talk about HR 1 and the changes to Medicaid, it's not just one thing. It's a series of things that taken together significantly change Medicaid as we know it. So expansion members will face eligibility reviews every 6 months instead of 1 year. The law reduces retroactive coverage and requires states to use additional information to identify duplicate enrollment. It also narrows Medicaid eligibility for certain lawfully present immigrants. We estimate about 5,800 will lose coverage. It also means that more people, there will be a significant part of the population that will be subject to the Medicare work requirements. When we think about Medicaid work requirements, these individuals are already working. What we know is that this will be additional paperwork that these individuals now have to demonstrate to be able to keep their coverage, or else they risk losing it. That means losing their access to their doctors. It means losing access to their prescription drugs. It means that people, and this is what happens naturally, will rely on our medical system only when there's an emergency. And we know that that is not the right way to maintain health and wellness. Next slide. It also changes the way that we traditionally finance our Medicaid program. Hospitals and other healthcare providers face a significant reduction in federal support. At the same time, they may be caring for more uninsured patients. This is particularly concerning for rural hospitals and providers operating with a narrow financial margin. When a rural hospital loses revenue, as you know, the consequences do not stay on a balance sheet. Families have to travel for care. Emergency departments carry more pressure. Maternity services become harder to sustain. Next. SNAP is also changing. Again, the changes to SNAP is not just one change. It's a series of changes that ultimately result in less people being able to receive the food that they need and the food assistance that they need to keep their families healthy and ensure that they don't go hungry. And then there's some additional consequences. I want to be clear about what the error rate is. It's not a measure of fraud. It can include underpayments, overpayments, incorrect calculations, incomplete information, and administrative mistakes. Starting in the next fiscal year, it also comes with a significant impact to Virginia, along with a shift in how much the federal government can use to support us. So it went from the federal government helping us 50-50 in funding our program, it will now shift to 75-25. That means Virginia will carry 75% of the cost. The federal government will now be 25. That is a significant increase in our cost to administer the program. You have already started seeing the impacts in other states such as Arizona, and you will hear more stories along the way of what that means for the ability to administer the program overall. So the administration began preparing early because waiting will have guaranteed worse outcomes. So I'm going to go through what our plan has been and welcome your questions afterwards, but just want to give you an idea of the work that we've been doing so far. So everything what we've done has been to protect Virginians. The governor worked with the General Assembly to invest nearly $500 million to help Virginians access affordable health care through the exchanges. That we have joined multi-state litigation challenging the new federal Medicaid guidance. We have put Virginia's concerns directly before the Centers for Medicare and Medicaid from both meetings behind the scenes, but also working with the administration. And we will continue on pressing for rules that are workable. But again, these are federal rules that we have to implement. Next slide. We are making dashboards available. We believe that transparency is very important. What you're seeing on your screen are not mock-ups. These are live already that demonstrate where people are the highest risk to lose their Medicaid coverage, but also where the highest risk to losing their SNAP. The goal is to use this information to inform regional conversations and help regional leaders work with the state to be able to minimize the risk. But again, this is very alarming because it demonstrates that no part of the Commonwealth is free from the impacts of H.R. 1. And one of the unique things that the governor has put in place is starting in September, the Department of Medicaid, Medical Assistance Services and Department of Social Services will hold a series of regional workshops across the Commonwealth. While this is a statewide problem, we believe in regional solutions. And so we'll be bringing leaders from across different sectors, private sector, providers, insurers to start to access what available resources are available in the community and work with each community to make sure that we have a higher level of readiness and ensure that everyone knows what they need to know and are prepared to take action. And then, this is our commitment. We will put the communication outreach and support in place to help vulnerable Virginians understand and meet the new requirements. We will build the systems necessary to determine eligibility correctly and process cases on time. Third, we will connect Virginians to opportunities to develop skills, find work, and build careers that provide a living wage. But we also have to be honest. Virginia cannot erase every consequence of this federal law. We cannot replace every lost federal dollar, and we cannot promise that no one will lose coverage. What we can promise is disciplined execution. We will communicate early. We will tell the truth about the impact. We will tell the truth about what we can and can't do. We will publish the data, and we will listen when the process is not working and try to fix it. And with that, turn over to you, Governor.
Thank you, Secretary Figuero, for that presentation. And now I'm going to turn it over to Jack to call on reporters for your questions. And again, thank you very much for your presence here. We'll also provide the PowerPoint afterwards if that may be of use for you all as you're putting together your coverage.
I'll give folks a few seconds here to go ahead and raise their hands, and then I would also like to just flag for everyone the new executive order that the governor just released related to H.R. 1. Is there any questions as that comes into your inboxes?
And as it comes into your inboxes, I'll just tell you what it is. Essentially, we have our Keep Virginia Covered executive order. This is an executive order that is creating the framework by which Virginia is going to continue to respond to the impacts of H.R. 1, the so-called One Big Beautiful Bill. It is putting forth the priorities that we are endeavoring to keep every Virginian that we can covered. It lays forth both the principles that will be abiding as part of that process, but also has particular strategies in place in terms of what we'll be doing with technology, what we'll be doing with outreach, and it lays out the plan that we have from an administration-wide perspective.
All righty, folks. Let's go ahead and kick it off with Chad.
Well, thank you for taking our questions. I was asking about the federal rescissions tracker that you had asked for in Executive Order 5. So I believe that was due sometime in March or April, and there was also an action plan that was due on the 1st of June. Can you share some details about, what the results of that report were? I think there was some, it was asking for a total of the amount of rescissions that were coming in for calendar year 2025 and projections for 26. So I just wanted to get some more details and texture about kind of what rescissions we're seeing in state government due to the federal changes.
If you don't mind, we'd love to send you that report in much more detail. I think what we saw at the time was kind of uncertainty as to what federal dollars we were going to continue to receive. Even if you think about HR 1, the definitions was still not final. And so there was still some uncertainty on it as to the numbers. So we're happy to provide that report to you.
Noting that there are some significantly some updated changes, and even with the HR 1 example, I think one of the things that's important to further dive in on is the fact that we had the interim rules that came out over the summer related to the actual implementation of HR 1 and how the states are supposed to implement it. Notably, the sort of overall assessments of how HR 1 would be implemented, that there was a lot of analysis on that last year at the time that the bill was proposed, when it was voted on, when the president signed it. But the interim rules are actually far more draconian and aggressive than industry or lawmakers or others assessed at the time. And just as a basic Virginia specific example, at the time, the estimates were that the full implementation of HR 1 would potentially cut about $30 billion out of Virginia's healthcare system. Based on the rules that were put out over the summer, that number has tripled to about $90 billion. And so we're happy to provide you with the earlier reports, but also recognizing that whether it's HR 1 or other federal policies, from kind of inception to actual implementation, we continue to see the story getting worse and worse for Virginians and ultimately for Americans. We're turning it over to Brendan at WTKR.
Oh, hello, Governor. A lot of important information there, but I also wanted to get your take just on another issue you've been focusing on this week. Just what are the consequences of a trade war with Canada in Virginia?
Brendan, I do want to keep the conversation focused on HR 1 for those who've joined for that purpose. But because you have brought forward a question that I cannot resist answering, I'm going to take a point of personal privilege and just say the consequences are absolutely catastrophic. It is absolutely outrageous and ridiculous that the president is starting a trade war with Canada. 50% tariffs on Canadian goods. We're expecting retaliatory tariffs to come in September. This with one of our nation's and Virginia's closest trading partners. This after the president in his first term negotiated the USMCA. I was a member of Congress when we put forth the implementation documents for that trade deal. It is one that has great benefit to Virginia industry, to Virginia companies, to Virginia agriculture, and the impacts of him essentially lighting that trade deal on fire and burning it all down in this aggressive trade war against the Canadians is highly detrimental to Virginians, to Americans broadly, and it is outrageously terrible policy. That put with the beef-related announcement where the president has announced that he plans to waive all tariffs on foreign produced beef. That's essentially more than 660 million pounds of foreign produced beef, and then flood the market with it subsidized at 25% under market value. This is catastrophic for the American cattle industry. It is an outrage for Virginians. We have more than 21,000 cattle operations across Virginia, the majority of which are family-run farms, and the impact of flooding the market with foreign beef that we are going to subsidize and bring in below market value. It is outrageously horrible policy. It is incredibly detrimental, and I'm happy to follow up a bit more about that in a future conversation. Back to HR 1.
All right, let's turn it over to Elizabeth Byer at Purple News.
Hi, can you guys hear me? Awesome. Thank you so much for your time today. Governor, you said that Virginia will not be able to, just kind of like piggybacking off of Jad's question, you said that Virginia will not be able to make up the difference in federal cuts. Can you provide like a little bit more detail on how this will manifest on the state level? Like how much is that difference that Virginia won't be able to cover? What programs will see cuts as a result of that inability to cover, and what happens next for the affected programs?
All right, I'll begin, and if the secretary would like to follow up, I'll turn it over to him. You know, even the basics, right? We talked about the SNAP program. The notion that currently SNAP is a 50-50 cost share with the state and the federal government. Moving to 75-25 is going to put additional costs on Virginia for us to maintain SNAP coverage for Virginians. That is in addition to the way that they have enacted a system where states will be penalized based on their error rates. So what we anticipate seeing is there will be Virginians have already begun losing access to food programs like principally SNAP. And that cost will pivot over to communities, to food banks. It means there will be kids in schools who are hungry, or the impact is significant. On the healthcare side, there will be thousands upon thousands, hundreds of thousands by the estimates of Virginians who are at great risk of losing their health coverage through Medicaid. That means, as the secretary mentioned, there will be individuals who will forego that well baby visit or that trip to the doctors when they're not feeling well, and they will show up in the emergency room a few days or a few weeks later. We will be shifting the cost of healthcare to emergency rooms, and we know that is the most expensive. There are already estimates out from healthcare providers. There's a lot of good research, and we'll provide a couple different other sources related to this, where we know it is just the reality of the circumstance that when hospitals cannot make ends meet and they have to cut departments, oftentimes labor and delivery, one of the most expensive of the departments in a hospital, is what's cut. So in addition to the fact that there may be pregnant women unable to get prenatal care or unable to deliver their baby in a labor and delivery unit, we're driving up costs when they show up having not had prenatal care to an emergency room for a higher risk delivery. We're also going to have economic impact because as I'm working with the Secretary of Commerce and Trade, trying to attract businesses to Virginia, among the questions that they ask is, what is life like? What is the housing available? What is the community like? If you're looking to recruit business investment to parts of Virginia, one of the principal questions is going to be, can you provide basic health care to the families that might be drawn by this employer? When families of childbearing ages don't necessarily want to move to particular communities because they cannot get the basic health access of going to an OBGYN and delivering in a labor and delivery unit, like that's actually untold economic impact on Virginia. I'm speaking, of course, specifically to Virginia, but we're not unique in this. These are the challenges that states across the country will be facing. We already know that we have seen the closure of rural health clinics because of HR 1, even last year. And so the impacts are significant. Separate from HR 1 was the federal choice not to continue ACA subsidies. So we took a choice at the state level to have state level subsidies to try and keep people insured. And yes, there's that benefit very specifically to those individuals, but it's a benefit to the larger system because the way that hospitals and the ways that insurers make up for the difference when people show up at the emergency room without any health coverage, without any preventative care, is it raises the costs for everyone. So if you're someone with private insurance provided through your employer, this will drive up your costs as well when you go to the hospital, provided the hospital maintains the departments and even it maintains its opening into the future. So while there are clear dollar amounts that we can calculate in various places as it relates to what it costs to keep X number of people covered, the overall kind of cyclical impacts of this bill will continue to be felt for years into the future, and in ways that with every forward-leaning, kind of thoughtful effort that we may undertake, there will be impacts that we just cannot mitigate against.
And the governor covered much of it. I will add a couple of things. One is that the changes are layered, so it makes it hard to plan. And many of the changes come into effect January 1st after the midterms. And so what we're seeing is a challenge is that while we cannot plan, the world is not waiting for us to plan. And so providers, if you look at one of the slides where we talk about hospitals are already looking at their balance sheets and saying to themselves, we cannot afford to keep this maternity ward open. We cannot afford to continue to provide behavioral health in a comprehensive way. And so while we're working with providers, we're working with the community to understand the impacts and what these numbers are. But again, it's by design. These changes are being layered on top of each other by design. And so it makes it difficult to wrap ourselves around those numbers. But we do know that this is going to have an impact. When you shift the cost of Medicaid, that means that there are less people that are going to be able to be covered and see their doctor. Less people are going to be able to afford their prescription drugs. When you shift the cost of SNAP, that means it costs more money for the state to allow people to have basic dignity of not going hungry. And so we're seeing those impacts come into effect right now. And it's by and large because while DC thinks that we have to wait on their timeline, the world keeps moving.
All right, let's go to Tyler Englander at 8 News.
Thank you, Governor and Mr. Secretary, for doing this. I wanted to ask what steps you guys are taking to mitigate or reduce that error rate that would cause the state to have to spend more on SNAP. You mentioned the increased administrative costs already, but what is the state doing to try and bring down the overall error rate to make sure the state doesn't spend even more money on SNAP?
So we're doing a couple of things. Look, no one wants to commit an error. And as I mentioned earlier, we are committed to reducing that error rate. I think the challenge is at the very same time that we're trying to address those issues that we may have with the administration of our program, we're losing millions of dollars in the ability to do so. So that's the first point. But we're also implementing a number of different programs. One, we have Fix and Find, right? So we're identifying where are the places where we have the concentration of errors happening and working with those local DSS social services to be able to address those issues that we're seeing. We're also taking that data and seeing where we can establish where there are trends. So now we're not only training that locality to improve their performance on that particular issue or subject area, but also using it to train other local social services to prevent and going upstream to ensure that that doesn't happen anywhere else. And so we're constantly iterating. We're constantly working with our trainings. We're constantly doing the work to make sure that that error rate gets as low as possible. But again, it is hard to invest in the administrative systems that we need to make these improvements at the very same time that we have the administrative costs shifting from a 50-50 to a 75-25.
Axios Richmond, Sabrina Moreno.
Hi, thanks so much for taking the call. You said that more uninsured patients could potentially drive up costs for privately insured Virginians. Is the state prepared to help hospitals absorb the additional uncompensated care to prevent those costs from being passed on to everybody else? And if so, what would that look like?
So I would begin by saying this is nothing new. This is the basic economics of the healthcare system, which is there have always been, and there presumably always will be, some individuals who do not have healthcare coverage. And it is the costs of ensuring, thanks to, frankly, EMTALA, a law signed into law by President Reagan, that guarantees the life stabilizing necessary care be provided to individuals who need it. And so it's the basic economics of our healthcare system that says that the purpose of insurance, the purpose of the way that we spread the costs of care does always include the reality that there are some individuals who do not have that coverage. Frankly, that is the value of the ACA, that is the value of Medicaid, that is the value of Medicare, ensuring that people, particularly vulnerable populations or those who do not have access to employer-provided health care, have the ability to get preventative care, have the ability to go see a doctor, have the ability to deal with a chronic illness rather than walking into the emergency room at a point in time where there is something catastrophic occurring. As it relates specifically to the hospitals and what we're doing to mitigate that impact, it is why Virginia is endeavoring to keep as many people covered as possible. So that investment in state subsidies is an investment in ensuring that we are lessening the risk that individuals may walk into a hospital with that emergency need because they haven't previously sought medical care. But importantly, one of the other elements of HR 1 is a change in the provider tax. And certainly, admittedly, cutting a tax sounds like a good idea, but indeed what it is that the Trump administration did with the changes to the provider tax is they are essentially pulling back dollars that previously had gone to hospitals to support their ability to provide care in communities across Virginia and across the rest of the country. So it is one additional way that this bill is negatively impacting the basic operations of hospitals across Virginia.
That's right. And we're working with the healthcare system in general. So we've been meeting with federally qualified centers, we're meeting with free clinics to see what is their level of being able to absorb some of these individuals that are going to be uninsured, which is going to be a challenge because despite the money, the resources that were put in the budget, they're not prepared to be able to take on as many people as we predict are going to be uninsured. When you look at all the different things that the federal government is doing, yes, you have the Medicaid changes and the reduction in support, but you also have the elimination of the enhanced tax credits that allow people to keep their coverage. So we're seeing both the destabilization of the marketplace, we're seeing also happen in the Medicaid, and now you have a range of individuals with a range of needs having to search for care that they previously had at a doctor's office or a clinic. And so we are wrapping our hands around what those numbers are, but without a doubt, there are going to be people who are going to be searching for care and not be able to find it because of the things that we're seeing from Washington.
"13 News Now."
Hi, thanks for talking with us today. Janet from WBEC. And I mean, you're talking about everything you're trying to do to help the hospitals and about the services that they would have to cut. Are you to the point now, from what you see and looking at the whole picture, that it's highly likely that some of these hospitals will just flat out have to close? Can you say that at this point?
Look, our goal is to not allow the hospital to close. And we're doing everything possible because we believe that people deserve access, because they deserve those services that allow them to remain healthy and in their community. If I take a step back and be realistic, what we can see is there's going to be a reduction in services that people rely on. And so in some communities, there will be the ability to stabilize the individual and have to move them somewhere else, or they will have to travel a significant distance to deliver their baby or to get their behavioral health services. And so we're working hard to make sure that the harm is reduced. But if you ask me flat out, we can't prevent the harm, given the significant reductions in the resources that we're seeing.
Thank you.
And just to add to that, certainly the estimates are that there will be hospital closures across the country. There have been clear numbers put around that, and certainly we know that there are a number of hospitals that have been identified as being at risk within Virginia. And that's just the reality of the trajectory that we are on. Our goal at the state level is to do everything we can to slow or stop elements of that negative trajectory. But the very real outcomes of HR1 is that there will be hospital closures across the country, and we're working to ensure that doesn't happen in Virginia. But by the numbers, we've already seen clinic closures. It is possible that we may see the same outcomes here in Virginia.
Thank you.
DT News Now.
Hi, Governor. Good morning. Thanks for taking our questions. We are covering the impacts of HR1 today, but we are also looking for your response to the announcement from DHS and ICE yesterday that mostly from Northern Virginia, 1,300 immigrants were arrested in a 2-week period earlier this month across Northern Virginia and Maryland. What was your reaction to that announcement, and what are you hearing from the immigrant community in Virginia right now?
I think broadly, the DHS, under its authorities to potentially act on deportation orders that may be in place, that is their authority to do so. However, what we have seen across the country and in parts of Virginia is an aggressive effort to make arbitrary quotas and detain and terrorize immigrant families. To be very clear, if there is someone who has committed a crime, whether they have legal status or not, they should be arrested and they should be prosecuted. But what we are seeing from the Trump administration is an effort to demonstrate some sort of strength of force, but to do it in a way that doesn't actually go after individuals who may have committed crimes. It is to do it in a way that terrorizes families, that makes school children afraid to go to school, and to do it in a way where their only measure is a broad brush number that doesn't speak to the circumstances or the situations. And in fact, we have seen the detention of American citizens. We have seen the detention of individuals with legal status. And so, as I have maintained, the sort of haphazard nature that the Department of Homeland Security operates in Virginia and elsewhere is one that I take real issue with the way that they operate and continue to create. It's as though their intention is to create fear as opposed to enforce the law.
Fox 5.
Hi, Governor. It's Tom Fitzgerald. Hope I have a question that you feel compelled to answer. Everybody has asked and answered my HR1 questions. So since you're already on this topic right now, we had reporting last week that there was a man in Fairfax County who was found not guilty by reason of insanity in Fairfax County. The guy was granted an unescorted 48-hour pass from the Northern Virginia Mental Health Institute. He then fled the country. He took off to Tajikistan, from what we understand. Is the administration looking at this case? And more specifically, would you look to end unescorted weekend passes for individuals who committed violent homicides? You just referred to this a moment ago.
Tom, I would be happy to follow up with you on this question. This one's so specific that I want to make sure that we have a chance to speak specific to the full details of this man's current situation.
Well, then, can I ask you on topic? Back in April, President Trump said that he didn't think it was possible for the federal government to fund Medicare and Medicaid and childcare costs because he said the nation, in his words, was prioritize military spending and fighting wars. I'm sure you heard this. A lot of states now are saying the federal government needs to get out of their election process, that's a state responsibility. Could you outline for folks what you see as a federal responsibility when it comes to healthcare and what is a state responsibility? Because the president is saying that national defense is what the government should be focusing on.
Well, Tom, this is one place related to the federal obligation to protect our national security. In principle, I agree with that statement from the president. But if he believes that to be true, the actual actions he continues to take demonstrate that he is not prioritizing our nation's national security, whether it is the ongoing war with Iran, where we, the United States of America, are continuing to use up our munitions and our defensive supplies, where we have seen the death of U.S. service members, where we continue to see absolutely zero strategy as it relates to what is our plan moving forward as it relates to Iran, where we see a freneticism where he's prioritizing the needs of the Chinese or other non-friendly nations. It is an outrage. The idea that the president would say that national security is a priority to him, but yet we have service members who are on a naval vessel in abhorrent conditions, jeopardizing our readiness, jeopardizing the actual health and safety of our service members. This is it is ridiculous that the president would assert that that is his priority. If indeed it is his priority, I would call his attention towards actually trying to contend with the national security implications of a gutted intelligence community, of State Department officials that are being pulled out of an entire region because he has created such an unsteady circumstance that we have intelligence and diplomatic officials pulled out of embassy after embassy throughout the Middle East with no clear end in sight. This is in addition to the fact that this president continues to wage economic war, first with Europe, then with countries throughout the rest of the world, and now with Canada. It used to be understood that America's strength in the world, that our national security was driven by the fact that we were a force for good all across the world. He is alienating our closest allies. It endangers American citizens. How about the fact that when we were suffering from forest fires, Canada sent forest firefighters to America to help us? One of them died fighting forest fires in the United States. Sometime later, as Canadian fires were burning, what did the president do? He threatened and ultimately now has implemented 50% tariffs on our Canadian allies. The reality is that he is saying that because it is a distraction from the very real lack of planning and lack of foresight and lack of any level of strategy, let alone investment in our military. But the very real circumstances of where we find ourselves with healthcare and his assessment that healthcare is not a federal priority, it is because at the time that H.R. 1 was passed, it was passed as a cost savings mechanism. As I know you all are aware, a reconciliation bill is the type of bill that you can do without bipartisan support. It is the workaround bill that can be used to get around the Senate filibuster. But the premise of a reconciliation bill is that it has to be a budget bill and it has to be balanced. So the cuts to H.R. 1, the cuts in healthcare coverage to people, the cuts in dollars to hospitals, the cuts in dollars to help put food on the table for hungry children, that is the way they achieved cost savings so that they could give tax cuts, loss of revenue, to the wealthiest Americans. So him saying anything about national security, one, is objectively not true given where we are in the current state of affairs, but also it is a distraction from the fact that the cuts to our healthcare system that we are seeing and will see into the future were in fact the cost savings that they needed in order to pass a reconciliation bill to give tremendous tax cuts to the wealthiest Americans.
And last one, Telemundo 44.
Hello, thank you for this opportunity. I'm Rosbelis Quiñones with Telemundo 44. I want to go back to what you mentioned about the no-citizens, thousands of no-citizens that will be affected by these federal cuts. I mean, many families are very afraid, and I want to know how your administration is planning to help these families affected by the federal cuts. I'm talking about the non-citizen families, and where they can go to get help, because they ask us that every single day.
Well, thank you for that question. Happy to answer it both in English and in Spanish. So we are working with local organizations to ensure that those individuals that are losing coverage are able to get the necessary services they need in other settings and other places. We're also working with the 5,800 families as well to see what kind of financial resources are available to them to be able to transition them into another care setting or another level of care that they previously had. Le digo que esta situación es muy difícil, principalmente porque los recursos que teníamos ya no los tenemos a nuestra disponibilidad, pero sin embargo estamos trabajando con las organizaciones de la comunidad para asegurarnos que esas personas todavía tengan el cuidado médico que ellos se merecen. Y estamos trabajando también como administración para asegurarnos que esos sistemas que previamente tenían en la comunidad todavía estén disponibles.
All right, thank you so much, everyone, for joining us today. We will be sharing a recording afterwards for anyone who needs it. Please follow with any questions you have for all of us. Thank you.